Hello everybody, Nelson Virtual here with ExcelMale.com. I'm going to be speaking about different factors that affect sex drive or libido or desire. A lot of men think that only testosterone is responsible for libido. In fact, there are many factors that have nothing to do with hormone blood levels. The most important one, in my point of view, is sleep quality. Poor sleep is probably one of the worst factors that decrease sex drive and even erectile function. While we're sleeping, our bodies are regenerating, hormones are produced, growth hormone output increases, melatonin increases, even testosterone starts boosting around 4 or 5 a.m. after enough REM sleep. So lack of sleep could lead to fatigue and could also lead to low testosterone blood levels and desire. Medication side effects like blood pressure medications are known to decrease, in many cases, sexual function and desire. Antidepressants, antipsychotics, most psych meds, even statins have been linked to changes in desire in many men. Stress and depression, basically it's like the big elephant in the room. A lot of men do not want to accept the fact that they're stressed out or even depressed, and that can actually definitely impact their sexual function and their sex drive. Obviously low testosterone, the most obvious one, and probably the one that most men on ExcelMale focus on. I do think that obviously we have data that shows that higher testosterone blood levels tend to be linked to better libido and sex drive, but however, that's obviously not the only factor involved. You could have great testosterone blood levels and still suffer from low desire. Infections, obviously when you're going through any infection from the flu to anything else, that tends to also affect your hormone levels and the way you feel about having sex. High prolactin blood levels is another hormone that has been linked at high levels to influence decreased testosterone blood levels and sexual function. Low thyroid can make you tired, low hypothyroidism, and obviously when you're fatigued, you don't really have much desire to do much, including sex. Alcohol and drugs, as we well know, and there are many stimulants out there, coke, even except for probably THC and marijuana, they cause decreases in sex drive, especially after long-term exposure. Surgery, pretty much like infections, tend to affect that too. Heart disease, there are several studies that linked heart disease with issues not only with desire, but also low vascular function and vascularity and blood flow to the penile area. High LDL cholesterol also been linked to sex drive and erectile function, especially in men that have metabolic syndrome. Obesity, like cholesterol and other factors here, also influence not only blood levels like high estradiol, but also can affect desire and sex drive. High blood pressure, including not only the blood pressure, high blood pressure itself, but the medications used to treat high blood pressure are well known to affect desire. Diabetes, also there are many studies that show people with diabetes have higher incidence of erectile dysfunction and low libido. So basically, the picture looks a lot more complex than just talking about low testosterone. There are many factors. Look at all of them. Talk to your doctor about them. Get out of denial on many of them. I think some of us are in denial about the stress and depression factors, even the sleep, and other even psychological factors I haven't really considered or reviewed in this slide. So thank you very much. There are a few other videos available on ExcelMale.com and also on our YouTube channel, ExcelMale channel. So check us out. Stay tuned for the next video. Thank you.